Hello, welcome to Mental Health Matters. I'm Barbara Meyers. On today's show, we focus on hoarding, a psychiatric disorder characterized by compulsively collecting a large number of items, making the person's home so cluttered that they're living in highly unsafe conditions. I am joined today by Dr. Michael Tompkins, who is an expert in treating anxiety disorders, particularly hoarding. He is the author or co-author of several books, including Digging Out, Helping Your Loved One Manage Clutter, Hoarding, and Compulsive Acquiring, which he co-authored with Tamara L. Hartle. He has also received teaching awards, including one as an instructor at the University of California, Berkeley Extension. Welcome, Dr. Tompkins.
Thank you for having me, Barbara.
Dr. Tompkins, can you give us a typical hoarding situation? Like, when would it start in someone's life, and what happens as a residence, and that kind of thing?
Well, actually, no two hoarding situations are the same. No two people with the problem are the same. But typically what happens is that hoarding behavior starts childhood, early adolescence. Individuals are showing that tendencies around that age, but they're somewhat managed by the fact that they're not independent. The children and the young adults live in the home of the parents. So there's some restraint on the hoarding behavior itself. Over time, particularly when they're emancipated, they leave the home, it can worsen. But generally, people will manage it somewhat for a while until there is some event. Sometimes that event is a trauma, sometimes that event is a loss, sometimes that event is a major depressive episode, a divorce, loss of a spouse, and then things really begin to unravel. Hoarding behavior goes on for many, many years for people, and there are some people out there right now who have been hoarding 50, 60, sometimes 70 years.
What are the consequences to the family members that might be living with someone who's a hoarder?
Well, living with someone who with this problem is very difficult. I mean, I like to think that not just the person with the hoarding problem suffers, but family members, even those who don't live with the person who hoards, suffer. But if you're living with someone who with this problem, it's particularly difficult because you're living in unhealthy conditions. Oftentimes you're living in quite uncomfortable conditions because in many of these homes and residences, apartments, people aren't able to, don't have heating, don't have air conditioning because the the air registers are covered with clutter. They may not be able to prepare meals, so they may be eating out a lot. There's also a great deal of shame and embarrassment for those who have family members with this problem.
So they can see that it's not, the situation that's created is not a good one, but they can't stop it themselves. Is that?
Or the person with the problem or the family member? The family member obviously is unable to stop the behavior, but the person with the problem has a great deal of trouble stopping the behavior for a lot of reasons. For some individuals, and perhaps even a large number of individuals, they don't see it as a problem, and nor do they see the behavior as a problem. Other individuals, usually younger individuals, actually can see that the behavior is a problem, and those individuals are more open to help.
And what are some of the sort of legal consequences? Can some people be evicted from their homes or lose custody of their children or something of that nature?
All of the above, absolutely. The consequences are quite significant. People can be evicted from their residence, whether that be an apartment or a home. Authorities can come in and actually condemn the property and evict the person, leaving the person homeless. People can lose the custody of their children if they have young children living in this situation. Also, divorce rates are quite high for individuals with this problem. And then just living on a day-to-day basis, particularly if you have a health problem, is really very dangerous. If you have a health problem, and a significant health problem, for example, and you needed to have medical attention immediately, emergency medical technician to come into the home. Some of these homes, an emergency medical technician could not even get into the home and certainly not even get their medical emergency equipment into the home.
Yeah.
So it's a dangerous situation.
Yeah. As you know, I tried to find someone who was a hoarder to tell their story, and I was unable to find someone after trying many different locations. And I'm thinking that maybe it's because of some of these risks, legal risks, that they would fear possibly having problems losing their home or their children or whatever. So I can understand why people might be reluctant to be publicly coming out in that situation. So
I would even add that the vast majority of these situations are private situations, not public situations, and the vast majority of people who are discovered are actually discovered, and not many people actually seek help, which is unfortunate.
So why is it that people can't stop their hoarding behavior?
Well, there are a number of reasons. One is that the behavior is reinforced. And sometimes, as I mentioned, over many years, 40, 50, 60 years, the behavior for individuals relieves anxiety and distress. For example, if they're considering discarding a possession, they become anxious about discarding it because they're worried that they may want it later and this will be a big mistake. They get quite anxious. They then keep the item. That lowers their anxiety. At the same time, another factor that increases the frequency of the hoarding behavior is that they actually, many people derive pleasure from the behavior itself, from discovering new objects that were lost. Also, compulsive acquiring is a piece of this problem where people actually acquire items, and actually not only do they get some relief because they see something they want, they feel anxious and this urge to have it, they get the object, they feel relief, but also they take pleasure. It boosts their mood a bit to acquire something that they like or they desire. So those factors contribute to the behavior. And then there are also difficulties with organizing, making decisions that make it difficult for them to declutter. So oftentimes these individuals might try to declutter, but they become overwhelmed and then stop. And the last feature that contributes to this is that this is a problem where people really isolate themselves, as you were speaking, not only out of fear, but also shame and embarrassment. And that isolation leads to them becoming more and more consumed by the possessions and over-focused on collecting.
What causes hoarding? What kind of risk factors, is it genetic link or social link or something like that?
Well, what causes hoarding? We're not really sure what causes hoarding. We do know that there are certain risk factors. There appears to be some research suggesting there's a genetic link. Some area on chromosome 14 appears to be related to hoarding behavior. Also, hoarding behavior appears to run in families. Part of that is probably a genetic, biologic piece, but also part of it may be modeling of the behavior by someone who actually has the problem too. So we really don't know. Also, other risk factors, people with this problem tend to have certain personality traits that put them at risk for developing the problem. Perfectionism is a big one. They also have other co-occurring conditions like social phobia, major depression, that may put them at risk of developing the problem. So we're just thinking that, as in most things, there are a number of factors that contribute to the likelihood of the person.
Do you think that hoarders may realize they're doing something that's dangerous or unacceptable, but not be able to stop?
I believe that some people do see that the behavior puts them at risk. I think also a large number of individuals do not or tend to minimize the risk. And my experience is that these individuals are older adults, and they tend to be living in the most dilapidated, risky environments. And again, these individuals have been engaged in this behavior for many, 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 many years. And so when you go in to look at an environment that they've lived in for 30 or 40 years, and you're making the argument that this is dangerous, they might look around and say, I'm doing fine. I've been living here for 20, 30 years. What's the problem?
Right.
So
is this a particular problem for older adults?
It's a very scary problem for older adults, because older adults present certain features of this problem that actually increase their risk of harm. One is they can be frail. They may have ambulation problems. Getting around just is harder. They may use walkers, canes. In a very cluttered environment, their risk of slipping and falling is extremely high, and we do know that first fall and that first broken hip is often the critical event that leads the person to gradual deterioration and death. Also, older individuals also have medical problems, and many significant and serious medical problems, where actually they might have an emergent situation where someone needs to get into their environment in order to help them, and because of the clutter level, they actually are in peril because the person may not be able to get in. And, last, many of these individuals would have trouble enough leaving the home if there was an emergency, because they are frail and they don't walk well and don't get around easily. But in a cluttered environment, the likelihood that they would be able to get out of their home if there were a fire or an earthquake is just really complicated.
Hoarding is classified as an anxiety disorder in the Diagnostic and Statistical Manual. And do you agree with this? And is this going to be changing in newer versions of the DSM?
This is a great question. Where to put hoarding syndrome is really being hotly debated by the real researchers in the field. And there are some reasons to believe that perhaps hoarding syndrome doesn't belong under an anxiety disorder. Heretofore, it's been considered as a subtype of obsessive compulsive disorder, OCD. But there are certain features of hoarding syndrome that don't quite fit with OCD. One is that typically hoarding does not respond to the same treatments that OCD responds to, and responds to really quite well. Another feature of hoarding that distinguishes from OCD is that the part where the hoarding behavior, there is some aspect of the hoarding behavior that is actually pleasurable, where that compulsive behavior is pleasurable. In OCD, the compulsive behavior is purely focused on relieving distress. So there are that pieces. And then there are also some brain imaging studies and even some genetic studies that suggest it doesn't quite fit under OCD. Now, where they're going to put that, I don't know. Whether they're going to put it under an impulse control disorder or a sub-disorder in some other area, I'm not really sure.
Does that make a difference as to how you would treat it?
It does. It has implications for it. With the DSM, in terms of diagnoses, one of the things that's really beautiful about the DSM is that the first step is, in order to actually understand how to effectively treat something, we have to know exactly what it is, right? And so in being able to actually put it in and describe it, I'm hopeful that researchers will be able to develop even more effective treatments for it.
Is hoarding hard to diagnose? Or how do you go about diagnosing it?
Is hoarding difficult to diagnose? Actually, true hoarding behavior is not as simple to diagnose as you would think. Many times people will go into an environment and see a highly, highly cluttered environment and think, well, my aunt or my sister is hoarding. But actually, not necessarily. There are a number of conditions in which hoarding behavior occurs. Dementia, for example, is quite common, and particularly with older adults, where this individual has dementia, but prior to the dementia they didn't engage in hoarding behavior. Now they do.
I see.
Autism too.
Okay. So when do you typically see a person who will come to you with this problem? Does a family member bring them, or do they come seeking help, or the court tells them to seek help, or something like that?
That's a great question. It really kind of depends. I mean, a person who's seeking treatment, often the person with the hoarding problem, will call for treatment. What research suggests is those individuals tend to be younger and tend to live in less dilapidated conditions. People who live in more dilapidated conditions and are typically older don't seek help. I don't get calls from them. I get calls from their family members usually. And then there's another set of individuals who will accept treatment because they are being forced to accept treatment. And We don't really know how well those individuals do in treatment. My guess is not so well because they're being forced into treatment. And those are individuals who are facing eviction or loss of their children.
When you first see a client for hoarding, how do you approach working with them? What do you look for? Do you visit their home, for example?
Part of the initial assessment, absolutely a home visit is actually required.
Okay.
And as part of the treatment, there will be several home visits along the course of treatment. It really is essential to be able to, one, get in there initially and see just how bad the situation is, and also to be able to identify what are the primary goals, what are we going to focus on in the treatment. And usually those are linked to the person's ability to function in the home and or what risks they're facing. So it's very important. And then we have home visits over the course of treatment to be able to see, are we making progress?
Make a goal of the treatment for what the person, relieving a dangerous situation, if that's what they have.
You focused on increasing functional living space through decluttering largely and discarding. Right? Another goal really is to help them with these skills that they're really weak in, like organizing, problem solving, decision making. Because when you think about actually organizing or decluttering your office, for example, there are a lot of decisions that are involved in there. There's a lot of organizing skills that are required, and these individuals tend to have a lot of trouble with that. And then the third goal is to basically teach these skills, help them understand how they think about possessions that leads to them keeping, how they think about things that leads to compulsive acquiring, learn some skills to kind of manage that behavior so that we can get the behavior down, improve their living situation, and help them kind of manage this problem over time so that the home does not become recluttered to that extent again.
Do you use cognitive behavioral therapy for this? Skills teaching? Or
the treatment that we know that's effective, the only treatment we know to date to be effective is cognitive behavioral therapy.
Okay.
Medications have not been shown to be particularly helpful in treating the hoarding behavior directly, although they're very helpful in treating other conditions that co-occur with hoarding behavior that actually makes it hard for the person to actually respond to the cognitive behavioral therapy.
So if they had depression or something,
ADHD, social phobia, things like that.
Okay, so then if you got the depression under control, then you might be able, with
more
medication, then you might be able to be more effective.
Absolutely. And there are many people who have this problem that are very, very depressed. I mean, there was a recent study that showed that actually 78% of individuals with a significant hoarding problem meet criteria for major depression.
Oh my gosh.
And they may not be, and probably are not being adequately treated for that mood disorder.
Do people ever get over this condition? Is it a chronic condition, or does it depend on the person, or whatever?
I think of most psychiatric or psychological conditions as chronic, in that the person is always vulnerable at risk of having a relapse, if you will. What cognitive therapy tries to do is to teach skills that the person can manage the condition and the symptoms so that they don't have the disorder. And really, when we think about disorder, what we think about is the symptoms are so extreme that the person is not able to function adequately or effectively on a day-to-day basis, and or the symptoms are extremely distressing for them. So through treatment, we try to get both those things down so the disorder disappears, and then hopefully they can manage it over time.
Do people ever get to a point where there's they don't have to continually be on guard, or maybe they always have to be on guard?
I think most people who have a successful course of cognitive behavioral therapy will tell you that they always have the tendencies. And what they've done is they've learned skills to kind of manage those tendencies, as well as skills to help them effectively declutter. And yet they still will have these tendencies. But tendencies is not necessarily a disorder.
Right. I've heard about some agencies that will come in and completely clear out a home like over a weekend. Sometimes you see those on television, the television shows. And I was wondering if I could ask you you thought whether these were effective or?
Depends upon what the goal is.
Mm-hmm.
If the goal of a clear out is to, generally clear outs are the person is removed from the residence, people come in, clear it out, clean it out, make it safe and habitable, put the person back in.
Mm-hmm.
If the goal is to keep the person in their home for a period of time,
mm-hmm.
in a condition where they're safe and healthy, a clear out works for a while.
Mm-hmm.
Relapse rates for clear outs are really quite high. In other words, when a person receives a clear out intervention, the likelihood that they will begin to engage in the hoarding behavior again is quite high. And in fact, some people suggest that actually people are more likely to intensify their hoarding behavior
mm-hmm.
after receiving a clear out. Right? However, clear outs sometimes are the only recourse, because if someone is in an environment in which they are living in a very unsafe environment, and then the goal is, let's make them safe. However, if your goal is actually to teach a person to manage a condition, clear outs don't do that. A person doesn't really learn anything about the problem, the behavior, the way they think about things, why they acquire, why they collect. Cognitive behavior therapy helps them with that.
How can family and friends help someone who's a hoarder? I know your book that you wrote is aimed at family and friends. What is your advice to family and friends?
Well, it really kind of depends upon really what the deal is with your loved one.
Right.
If your loved one, if you're catching this problem early and the person is relatively young, let's say in their 40s, they may be more open to actual treatment. And what I usually recommend to families is, talk with them about this problem. Share your concerns with your family member about the behavior and the situation in which they're living. And at the same time, offer to do some research and say that I think there actually is help for you. I think there is treatment that can help. Would you be willing to let me, do that research, find those resources? And then the family connect them to those resources. That would be enormous. That's a group of individuals who may have adequate insight and a willingness to actually accept treatment. The more complicated and difficult situation is when you're a family member and you have a loved one who appears to refuse and consistently refuse any help at all, including your own, including you offering to help. Declutter, discard, make this living situation more healthy and comfortable. That's a more difficult situation. That's really what the focus of my book is, really. And what we really try to emphasize there is really trying to manage the risk through working with the loved one to actually focus specifically on certain targets that put the person at risk, try to manage those targets so the person can continue to live in their home, but more safely and more comfortably.
Okay. So you would be working at that point with a family member, right?
Largely the family member, although what we advocate in the book is actually a team where the person with the problem is on the team, the clinician, a clinician could be on the team, the family members could be on the team, but there also could be other representatives on the team, professional organizers, a particular friend, a physician that the person has a long history with could be on the team. And then the team assists the client to manage the hoarding problem.
That's like a holistic treatment.
Yeah. Well, that's because this problem is very difficult, particularly for people who are refusing treatment and live in really unhealthy conditions. It's a very difficult problem, and it really requires a team effort. And I think actually for people who are in this category where they're less open to help, that you want to think about helping them more like a marathon than a sprint. You just keep hanging in there with them, working with them over time.
So the relationship, it seems, with their family members is really important.
Oh, the relationship is essential.
Yeah.
Absolutely, because it's really the only leverage a loved one has. And unfortunately, an outgrowth of a hoarding problem is that the relationships become distressed and deteriorate over time because the family members are going in trying to help, help discard, offer to throw things away. They may have even thrown things away without permission. There's a lot of resentment, anger, distress in those relationships. And so in the book, we really advocate family members starting with trying to rebuild the relationship with their loved one before they move in. We even call it like clear the air before you clear the clutter. That it's really important to work on the relationship first.
If someone wants to find a therapist to help in hoarding behavior, either themselves or their family members, how would they go about doing that?
There are really two really great resources that I recommend. One is the Obsessive Compulsive Foundation has a website, and they have a hoarding center within that website where they list people who have expertise in treating hoarding behavior. These are cognitive behavior therapists who actually know how to treat it. Another organization is the Association of Behavioral and Cognitive Therapies. They have a website, and those individuals also are experts in cognitive behavior therapy, and many of them will have expertise in treating hoarding behavior. So those are two websites I would go to first.
Okay. Well, thank you very much. So I have some resources that I'll share with you. The first is the book that Dr. Tompkins wrote with Tamara Hartle called Digging Out, Helping Your Loved One Manage Clutter, Hoarding, and Compulsive Acquiring. It was written in 2009, and you can get that on Amazon. The other are some websites that may help you. One is the San Francisco Bay Area Center for Cognitive Therapy, where Dr. Tompkins works. That's sfbacct.com. And secondly, the International OCD Foundation Hoarding Center. That's ocfoundation.org/hoarding. Next, in help in locating cognitive behavioral therapists, one of the things that Dr. Tompkins told us is a website called abct.org, and that will help people find cognitive therapists. And then finally, in the San Francisco area, the Mental Health Association of San Francisco has a lot of people who have been through this problem in support groups, MHA-SF.org, that you might want to check out. I'd now like to leave you with some closing words. Take courage, friends. The way is often hard. The path is never clear, and the stakes are very high. Take courage. For deep down, there is another truth. You are not alone. Thank you for watching, and we'll see you next time.